So I think the core question there, the first part for those that might not have heard, is why was the 90 days chosen, right? And completely agree with your comment of the greater the time frame, the better the improvement for the health for the individual, the more stabilized that health for the individual can be. 90 days is the limit that CMS has approved thus far. As I mentioned earlier, Illinois and Washington, D.C. had applied. Didn't matter about timetable. They wanted as soon, if that member was Medicaid eligible when they entered, instead of freezing their Medicaid eligibility, they would continue that eligibility during the time that they were incarcerated, and Medicaid would have that continuous coverage throughout. Those were rejected. It's going to take an act of Congress to get to that point. So I still think there is federal advocacy efforts that are needed. Our hope here, and it is arbitrary, 90 days, other states have chosen 60 days. It's somewhat of an arbitrary selection. The idea being, can you create enough months where you can stabilize the patient with a care management program and enough lead time where you then can coordinate for services to continue post-release. But 90 days is a little bit arbitrary, and I think all of us would love to have it lengthened as far as we can get it.
There's no medical or clinical science behind the 90 days. I do want to tell you, I mean, I'm Irish, so I'm Pollyannish too. So on the front end, there's a big movement across the country. You guys know this. 2/3 of jail inmates have not been convicted yet, right? They're waiting court work, right? There's movement across the country to actually allow Medicaid to cover the entire time until you're convicted. That would cover 2/3. Now, that's even a bigger rock up a hill to push, because the feds say, holy smokes, that'll be a lot of people. And the feds are paying 2/3 the cost in Michigan. So, I mean, I think it's partly a fiscal restraint, the 90 days. But let's keep pushing on the front end, too. I mean, it's just plain wrong. If I haven't been convicted, I just can't afford to get out because I can't get bail money. I'm just that poor, right? And sometimes, you guys know this, if I have a substance abuse issue or a mental health one, I almost always live in poverty. And so the chance of me getting out, not because I'm violent, in fact, most of the time it's not a violent offense, I just can't afford to get out. I lose Medicaid, I decompensate further until the 90 days kicks in. And you guys know this. Try to guess what the 90 days is for somebody who hasn't been convicted. You can't. So I think jails will be doing some pretty good math, trying to figure out, I think Bob will be convicted of vagrancy or who knows what, right? Or breaking into someone's home because he thought that was his home. And which just happens a lot. And before he's convicted, I think he'll be convicted, and I think he'll have this kind of term. I'm going to start the 90-day clock. There will be a lot of guesswork here. So I'm glad you have the same ire that Dominic and Sam and I do. We agree completely. Yeah, it's stupid. I guess I could have just said it's stupid. Yeah. But you know the thing about, you can't re-educate stupid sometimes. You have to kind of live with it. But we're willing to take a slice. We can't get the whole loaf. We're willing to take a slice, a 90-day slice.
I just want to add on to a point that Dominic made about needing an act of Congress. There are plenty of resources on the MAC and NACO websites around the bipartisan federal legislation that's out there right now to reform the Medicaid inmate exclusion policy. You know, there's template letters to send to your congresspeople and our senators here in Michigan. So our lobbying efforts aren't just at the state level on getting this waiver, but also at the federal level to reform the policy as a whole. And it's no small feat. So this is years in the making.